Today, as we begin the celebrations for World Breastfeeding Week 2020, being observed this year from 1st to 7th August 2020, all of us as parents, community members, and policymakers can agree that breastfeeding is a vital part of providing our children with the healthiest start to life. Breastfeeding in St. Kitts and Nevis has had a rich and compelling history, with our federation seeing the highest rates at the inception of our nation. However, during the past years, breastfeeding rates have risen and fallen subject to the times. It is popular belief that medicine, science, and the formula industry have had the most impact on these rates. The Ministry of Health is committed to protecting, promoting, and supporting breastfeeding through advocacy. Two of the ways in which we are doing this are: 1, through the implementation of the 10 Steps to Successful Breastfeeding, which was introduced by UNICEF WHO as part of the Baby Friendly Hospital Initiative, which was launched in 1991 as an intervention strategy for strengthening the capacity of national, regional, and local health systems to protect and support breastfeeding. This guide, along with the International Code of Marketing of Breast Milk Substitutes, as we understand that not all women may be able to breastfeed, provides the best practices for ensuring that our maternal and child health facilities create a welcoming breastfeeding environment for mother and baby. And 2, through our continued advocacy for the creation of a positive environment in all workplaces to support breastfeeding clients and employees. Supporting breastfeeding also requires us to challenge the barriers to breastfeeding, wherever these may arise. These barriers can exist in the home, in our communities, in our workplace, and in recreational spaces. Therefore, we must ensure that women who opt to breastfeed feel comfortable doing so and are successful. It is also important that we create a resource pool of experienced breastfeeding mothers who can influence new mothers to see breastfeeding as achievable and enjoyable. The long-standing benefits of breastfeeding are backed by strong scientific evidence, which suggests that breastfeeding helps to protect against obesity, hypertension, dyslipidemia, and type 2 diabetes during adulthood. Because of these benefits, we strongly believe that collaborative action between government and private providers of healthcare will be crucial if we are to achieve and sustain higher breastfeeding rates. It is my belief that breastfeeding is critical for the public health of our country. Our common aim, therefore, should be to re-establish breastfeeding in St. Kitts and Nevis as a cultural norm, thereby making it the natural choice for the vast majority of parents. Throughout this week, the Ministry of Health will celebrate Breastfeeding Week with the airing of a mini-film which highlights the importance of breastfeeding using our very own mothers and healthcare providers. We will also be launching the Maternity Guide, which will provide support information about breastfeeding with the intention of making these guides available to all expectant mothers. In the Ministry of Health, we stand ready, as always, to do all we can to increase the breastfeeding rates. Let us all do our part as well and continue to eliminate the breastfeeding taboos and support our mothers as they provide the healthiest start to life for our nation's children through breastfeeding. Thanks for listening.